I was diagnosed in 2014. I was 33 years old. I felt some pain in my right breast, so I went to my doctor to get it checked. I went to have a mammogram, and they did an ultrasound, and they found some calcifications in my left breast. Asked me to have a biopsy done because it looked a little abnormal. Had a biopsy on a Friday, and Monday morning they called me to come into the office because it was positive for breast cancer.
We were just looking at some of those pictures, and so you had chemotherapy.
I did. I had 8 rounds of chemotherapy, but prior to that I did have surgery at a double mastectomy.
A lot to take in for being so young.
Yes, it was.
You went through you reached the 5-year mark, and you thought everything was good, but it wasn't what you thought it was going to be.
Right. Starting March of last year, was having some pain in my back. Went to the doctors to get it checked. They, said it was musculoskeletal, ordered some physical therapy for me. Went to 2 sessions of physical therapy, and the physical therapist could tell that it wasn't helping and asked my doctors to order some imaging. I had a CAT scan and a bone scan that showed a lesion that was suspicious for metastatic disease. Ended up having a bone biopsy, which proved that it was metastatic.
And your reaction?
I was frightened. I was scared. I've met a lot of women who have passed away from metastatic disease because it is the cancer that kills women and men who also get breast cancer. 115 men and women each day die of metastatic breast cancer.
It's a lot to take in. You work, you're a mom, you're a wife.
Yes.
They all help in your journey, though.
Yes, my husband and my daughter have been my biggest cheerleaders. My parents and sister and my friends and coworkers have been a huge support for me, helped me get through everything. So.
And talk to us about the latest news you've received.
So unfortunately, I found out recently that the cancer had spread to my liver. It is a small spot on my liver, and it's only one spot, so it hasn't completely spread throughout. So I this week actually started on a clinical trial that will hopefully dissolve the lesion or help treat it and keep it from metastasizing elsewhere.
I was going to say, you look great. How do you feel? This is almost like a chronic disease.
It is. Metastatic breast cancer is a chronic disease. There is no cure. I have days that I feel great. Other days I'm very tired. I have, pain in my bones. But, I just take each day at a time and, go with it.
And what's your message, your inspiration to others who are watching?
So my biggest message is we definitely need to find a cure or a, way that, why is this metastasizing? Why do women who get breast cancer have metastatic breast cancer? Only 2 to 3% of funds raised through breast cancer research goes towards metastatic disease. So we definitely need more funding to find a cure or find a solution.
And as far as follow-up for you, how often are you monitored?
So I am going to have to get, with this clinical trial that I'm on, blood work once a month and scans every 8 weeks to make sure that everything is still working as it should be and nothing has gone to any other spots or like my brain or anywhere else. So.
Oh, Tiffany, thank you so much for sharing your story. We wish you the very best. I wish I could come over there and give you a hug.
Me too, Deb.
Oh, my
Thank
goodness. You. But yeah, we do wish you the very best in this journey.
Thank you so much.
Positive attitude.